Hello everyone and welcome back to the channel. My name is Jubril Amzad, a registered nurse and a nurse educator. In this video, we will discuss about the biological aspect of aging. Let's begin. What are the objectives for today's lesson? In this lesson, we will describe theories of aging. We will also explain normal physiological changes that occurs during aging. We will also differentiate normal aging from diseases. Now, this lesson will explain how aging affects the body. Let's open up this lesson with biological aging. What is biological aging? Biological aging is gradual, irreversible physiological changes with age. These changes affect the cell, the organs, the tissues, the body system. It affects your whole body. It leads to reduce in functional reserve. It reduces the functional ability of your body systems. Now, what we need to remember as nurses is biological aging is normal progressive process. Now, let's see what normal aging is. When we say normal aging, these are predictable changes without diseases. These are changes that occur as you are aging, but without diseases being involved. Changes are gradual and usually mild. These changes does not significantly impair independence as these older adults are aging. What we need to know here is normal aging is not the same as illness. In normal aging, it is not associated with any form of illnesses. Now, let's see the difference between normal aging and diseases. In normal aging, there will be reduced in system functions, whereas when disease is involved, these systems would have organ failures. That is quite the difference. In normal aging, there is no diseases, whereas in diseases, as you are aging, there will be damage to these organs. Another difference that we can see is that diseases, as you are aging, are mostly treatable and they can be prevented. But in normal aging, there is nothing to treat. And then normal aging is irreversible. And a good example is when we say memory that is slowing down in relation or compared to dementia. When we say dementia, this has to be a diagnosed condition for individual, which means that it has a cause and can be managed. But when we say slow in memory, it has nothing to relate with diseases. This is an aspect or a part of cognitive decline as older adults are aging. Now, what do we need to remember in this slide is that nurses must always distinguish between normal aging from diseases. Now, let us see the theories of aging. In this lesson, we'll be discussing about theories that are associated with aging. Now, the theories that we're going to discuss in this lesson would be three theories in these lessons. So, theories here explains how aging process occur. It tries to tell us what are the processes that takes place during aging. In simple terms, the theories here try to explain the complexity, the multifactorial, what occurs during aging. The two theories that we'll be discussing about it would be the genetic theory, the wear and tear theory, and lastly, the free radical theory. Let us begin with the genetic theory. When we say the genetic theory here tells us that our genes are programmed for aging. It tells us that there is genetically programmed gene in us, which means that since we're still alive, we would age. It is programmed in our genes automatically. This is what this theory is telling us. And this theory also added that cells have limitation towards their divisions. It is telling us that while cells divide, they have limit. This limit is what we refer to as the Hayflick limit. This Hayflick limit is being advanced by Leonard Hayflick, who in the 19 period, I think in the 1962 or so, was able to advance and let the people know by then that cell division isn't infinite. It has limits. It shows and tells us that cells divide for a period of about 40 to 60 times before they will reach a stage of senescence. It tells us that cells does not divide infinitely, but rather has a certain period or a number of times that it can actually divide before it will reach a stage of senescence, before it will reach a stage of deterioration or a stage whereby it can no longer divide anymore. So in this genetic theory, what we need to remember as nurses or nursing students is genetics would influence the aging process. Now let's look at the second theory for this lesson, which is the wear and tear theory. In the wear and tear theory here, it explains the process of aging as a result of stress. What this theory is telling us here is that there is accumulative stress to the body, which is leading to the damage of cells. And these leading to the damage of cells would reduce the ability for repair. It means that the more we use our body, the more we damage cells. The more we damage cells, there are lesser cells, or there is no repair that is going on by these cells multiplying. So in simple terms, it is simply telling us that repeated stress will contribute to aging. That is what this theory is trying to say regarding aging. This is why we refer to it as the wear or tear theory. You stress yourself, the cells die, and then your repair level or functionality as a human being would decline. The third theory that we will discuss, it's going to be the free radical theory. In the free radical theory is more of the chemistry aspect of the human body. In the free radical theory, it is telling us that during cell metabolisms, we have byproducts that are released, which are referred to as free radicals. These free radicals, when they are left moving around inside the cells, they are going to bind with oxygen, and then they start destroying the cells through oxidative process. But in our cells, we have what we refer to as antioxidants. When these antioxidants bind with these free radicals that are within the cells, it is going to make them stable, and they won't have to what? Damage the cell membrane. So in the free radical theory, it is telling us that as we are aging, there is a reduction in the antioxidant. So when there is a decrease or there is no antioxidant to bind with these free radicals, these free radicals would bind with oxygen through an oxidative means and destroy the cell membrane. So it's the chemistry aspect of how cell membrane is being destroyed by free radicals, but it is still explaining a concept of cell membranes would be destroyed. Now, what we just have to know in this theory is that oxidative stress would accelerate aging. The more these free radicals are binding with oxygen in the cells and destroying the cell membrane, is going to accelerate the level of aging. Now, those are the three theories that we have in the biological aspect of aging. Now, let us look at the importance of these theories in nursing. Why do we find these theories to be important to us as nurses? Now, one of the key reasons why we find this theory to be important as nurses is because it explains the various response of illnesses. It explains how illnesses would respond. So when we understand this theory, it will help us to analyze and explain how we are responding or how older adults are responding to illnesses. Another importance of this theory is it supports preventive and also health promotion. So knowing this theory is going to help us to be able to prevent and also promote health for the older adults, and it will guide for individualized care. And in general, aging theories would improve nursing care. We can just see it as a leveling up our skills as nursing so that we can give a proper care for the older adults. Now let's look at some changes that will occur in some of these systems in the older adults. Let's begin with the cardiovascular system. In the cardiovascular system, the changes that you would see that will occur as older adults are aging would be your blood vessels would get stiffened. When they get stiffened, they're going to lose their elasticity. So they won't function as they used to when these older adults were much younger. There is also increase in systolic pressure seen in cardiovascular changes, and then there will be reduced in cardiac output during excessive work or during exertion. When you start to do a lot of efforts, trying to do a lot of things, there will be reduced in cardiac output. These are the changes that you would see in cardiovascular system. So what we just need to remember here as nurses is aging affects heart efficiency. As you are aging, your ability of your heart to function fully would be deteriorated. It's going to reduce in its function or capacity itself. Nursing implication towards the cardiovascular system. What do we need to do as nurses? Since these changes would occur in older adults. So as nurses, we need to ensure that we monitor the BP and the heart rate for these older adults. We also encourage physical activities for these older adults. We also promote heart-healthy diet. In general, as nurses, monitoring would reduce cardiac risk. Now let's look at the respiratory system. So what changes can we see in the respiratory system? In the respiratory system, we would observe that as older adults are aging, they will be reduced in lung elasticity. So the elasticity of the lungs is going to reduce. There will be weaker respiratory muscles, the muscles that allows for proper expansions and relaxation would be weakened. And then we'll see that these older adults would have higher infection risks. Aging here would reduce respiratory efficiency. Let's look at another system, which is the musculoskeletal system. In the musculoskeletal system, we will find that there will be loss of muscle mass, sarcopenia. There will also be reduced in bone density. The thickness and the hardness of the bone would be reduced. And then we'll see that there will be joint stiffness and pain in these older adults. So musculoskeletal aging would increase the risk of fall for these older adults, since most of the bone is weakened and then the muscles are also weakened. So it brings about easy fall for these older adults. Another system that we want to look at is the nervous system. In the nervous system, the changes that would occur is they will be reduced in the neurons. These nerve cells that are responsible for sending signals would be reduced. This would lead to a slower conduction. There will be slower in nerve conduction, and then there will be delayed in reflexes in these older adults. We need to note or remember in this slide is that nervous system aging slows response. So as the nervous system is aging in older adults, they are also reduced in response for these older adults. Let us look at the immune system. The same way every other system is going to deteriorate, the same way applies for the immune system. There will be reduced in immune response, there will be increased infection risks, and slower healing. So immunity weaken with aging. As older adults are aging, the immunity will also be weakened. What will be the nurse's implication in all of these changes that are occurring to the systems of the older adults? As nurses, we need to ensure that we conduct regular assessment. We need to do proper assessment and thorough assessment for these older adults. We need to differentiate aging from diseases. We must try as much as we can to differentiate between aging and diseases. We need to promote healthy lifestyle as nurses. So these are some of the rules, these are some of the implications that is upon us as nurses to ensure that we fulfill for these older adults. So nursing care must always adapt to aging changes. So despite the changes that is occurring during aging, you have to adapt to these changes as nurses. In conclusion, biological aging affects all body systems. So we need to remember that biological aging does not affect one system and leave the other. It affects all the body system in the human body. So understanding aging would improve quality care. And then lastly, nurses promote healthy aging. The knowledge of aging will support safe nursing care. Now that brings us to the end of this lesson. Thank you for watching this video. And if you are a nursing student, remember to revise these topics and apply them during your clinical practice. Don't forget to like, subscribe, and share this video to your colleagues. In the next video, we will discuss the next topic. See you then.